Biggest misconception that patients have about laser treatments is that your skin has to be extremely damaged or that the laser can actually damage your skin. It's not the case. Laser can be used for subtle enhancements. Laser can also be used for larger enhancements. Really just kind of depends. The other misconception is that there's a lot of downtime with each laser, that you're going to be red, crusty for weeks, maybe a month. It's not the case. There are some lasers that kind of have that downtime, but with our lasers, we don't have that. We can change the settings and adjust them to each patient's concern, their skin type, etc. So I'd say those are the biggest misconceptions, but they're very easy to overcome once you do like a consultation with our providers. Biggest question is, does it hurt? Some lasers are a little bit more painful than other. We really tailor it to what your treatment goal is, and then also what kind of pain tolerance you can handle. And then if something is too painful, there are different lasers that we could always choose to utilize instead. So that's the biggest question. I would say on a scale of 1 to 10, lasers are about like a 2 to 4 for most patients. Each laser kind of has a different pain sensation that is described in detail to you before your treatments. Another question that patients ask is, how long is my downtime, and am I going to be able to leave my house? The answer to that is it depends on the laser. Most of the time the answer is yes. Typically you can cover with makeup for most lasers the next day and leave your house, kind of do your normal activities. The main thing is just sun protection when you do leave your house. So that's the other thing, is that a lot of patients will come in and say, what kind of restrictions do I have afterwards? Main thing is sun protection and no active ingredients in your skincare routine and nothing exfoliating. So when we do the laser, we're kind of doing some intentional damage to kind of get our immune system to start repairing things and getting us to those goals. So we don't want the sun to then further that damage, because it could kind of reverse what we're doing or potentially make it worse. So that's why we really emphasize sun protection with sunscreen, and then sun protective clothing, hats, etc. And then we also emphasize nothing exfoliating. We want the skin to kind of heal naturally on its own. Think of the Alma Harmony as your Swiss Army knife of lasers. There's multiple different hand pieces, there's different settings that can treat different things. So I think that's really what sets it apart, is I could have almost any single patient walk through the door and I could have some type of laser that would be great for them, and it's safe for all skin types. So whether you have a lighter skin type or a darker skin type, it is completely safe. We change it to your skin type and to your goals. So the main things that we see with the Alma Harmony is addressing brown spots, so typically like sunspots that we'll get as we get older, redness, some like rosacea, telangiectasias, cherry angiomas, those are the big ones. We can also do some light resurfacing, so you can do like fine lines, wrinkles. We do have an ablative handpiece as well, where you can do a more deeper treatment for some of those deeper wrinkles and fine lines. You can do some revolumization, some collagen stimulation, so you can help volumize the cheeks, volumize the jawline, the lips. You can do some tattoo removal depending on the color of the tattoos. You can do other types of pigment removal with a different handpiece. Let's see, what else? Acne scarring, post-surgical scarring, just any type of scarring could really be beneficial. Yeah, you can literally do pretty much any skin concern. The Alma Harmony can have some sort of benefit with it. Almost anybody is an ideal candidate for it. I will say the most common candidate that I have is typically patients in their like 40s to 60s that have some of that cumulative sun exposure over time, meaning that it wasn't just from one weekend of getting a sunburn while you were down on the beach. It's from years and years of sun trauma over time, where we have those dark spots that kind of pop to the surface. So I'd say that is a really good candidate. Another excellent candidate is somebody that has acne scarring. This laser does excellent work for acne scarring. Could actually also even treat active acne too. So a lot of patients will like to do it before like homecoming or prom, or if they have like a big work event and they have a pimple pop up. So there's really no perfect candidate for it, but everybody would be a great candidate for the laser. It depends on what we're treating, but I tell patients to expect anywhere between 3 and 5 sessions. Typically on average it's about 4. Sometimes some scarring concerns like acne scarring does take a little bit longer, just because those are a little bit deeper of concerns. So we like to kind of go progressively to get a little bit deeper each time, to address it a little bit more each time. But again, each patient will build collagen, each patient will build elastin, each patient will decrease that pigment on whatever their skin's protocol is. So we really tailor it to the patient. So we like to say estimate about 4. Sometimes it's more, sometimes it's less, but that's what's nice about Apex, is that everything's customized to you. So if we're doing a laser that's addressing more of those browns, more of those reds, immediately afterwards your face is going to be a little bit red, like you have a sunburn. Those dark spots are going to be a little bit darker. That sunburn sensation typically goes away that next day. Those dark spots may be a little bit darker. Typically on like days 3 to 5, they get a little bit darker then. They look maybe like a little coffee ground scabby guys for a couple days, and we just let those kind of flake off off on their own. But again, you can start covering with makeup immediately afterwards. You can kind of do your normal routine besides the active ingredients. So there's not too much downtime with this laser. Each time I would say the downtime's a little bit less depending on what kind of treatment protocol we're following. So I tell patients, if you're interested in doing laser treatments and you're worried about what you'll look like afterwards, plan the first one where you don't have anything big going on that weekend, no like wedding, graduation, big party, just in case we need a little bit more downtime. And then in the future, when we're planning the other laser sessions, we'll know what that downtime looks like so we can plan accordingly. For the laser that's addressing more acne scarring and more wrinkles, that one, again, a little bit of a sunburn redness appearance that day, but in like a couple hours it starts to go away. Typically by the next day they look completely normal. That one, there's very minimal downtime. Then we have another one where it's kind of stimulating that collagen. That one you don't really look any different. You will have that collagen stimulation, that nice plumping effect, but you won't have any true downtime with that one. So that one's a nice like lunchtime laser. Yeah, so with the laser, because of how many different hand pieces we have and because of how many different concerns most patients have, most patients don't just have one concern, they normally have multiple. So we're typically combining different lasers to get us to our best result. But if we're trying to combine something besides laser, I typically see patients doing like Botox or filler during that same day. A lot of patients will also add on like a microneedling treatment. Typically don't like to do any chemical peels during the laser, but Botox, filler, microneedling are typically the three most common that we'll add on, and then also kind of different skincare products for each laser as well. So one of my patients that I've been treating, her main goal was just to feel better about herself. Her biggest concerns were the dark spots on her face, the wrinkles on her forehead, and the fine lines around her mouth area. She also had some concerns for the dark spots on her neck, so we did the Alma Harmony addressing the dark spots. It also had some collagen stimulation which helped with the wrinkles and the fine lines, but we also added on a little bit of lip filler to help with the lines around her mouth, and then we also added some Botox to help get her to her goal. She was very nervous, very conservative at the beginning of treatment, but once she saw the impact that the treatments could have, that's when we really kind of started jumping in and kind of really getting to where she wanted to be, and she looks like a completely different person. Night and day difference for her in her personality and in her overall confidence in the way she presents herself in the office as well. So this laser really mainly does browns, reds, acne scarring, fine lines, and wrinkles. This laser is different from others because it's extremely targeted to the patient's skin type, and it has, again, customized settings to each goal that we can do for skin types about 1 through 4. This laser is an excellent laser. It's something that I've used in the past where we've had really good results with the IPL and the Resurfix handpiece, so we can get patients to where they want to be. This laser is really customizable for pain tolerance as well, which is excellent. So I think that's really what sets this laser apart. It would be very similar to kind of the Alma Harmony candidate, somebody that has those browns or those reds or those fine lines or wrinkles, or again, acne scarring. Those are typically the best candidates for this laser, and typically skin types 1 through 4 would be the best patient profile for that. It would be anywhere between 3 and 5, sometimes more, sometimes less. The rough goal is about 4 sessions for most patients. Recovery for this one is very similar. It's the same thing where those brown spots will get a little bit darker. They'll kind of slowly slough off. They may look like coffee ground scabby guys for a couple days, but those slowly will go away. You may have a little bit of redness immediately after the treatment that will then hopefully resolve by the next day. With the one that is targeting the fine lines and wrinkles, we have a little bit of swelling and a little bit of redness that lasts anywhere from 24 to 48 hours. Most patients see the resolution the next morning when they wake up. So there's not too much downtime associated with this one, and we can also customize the downtime according to whatever needs the patient has. Nothing different with combinations. It's very similar where we kind of add on Botox, filler, microneedling, depending on the patient's goal. Again, no chemical peels. Something I've done is I've actually cool sculpted patients during their lasers as well. This laser also does some laser hair removal too, so that will help the pigmented hairs. It will not help any like lighter or blonde hairs. It only addresses darker hairs. So that's something that really sets this laser apart too. Yeah, so one of my patients, her main concern was that she had increased pore size all across her nose and then up through here in her T-zone. She's had it forever. That was one of her biggest concerns, is that she felt like she always looked oily even though her skin didn't feel like that. So we were doing the Resurfix laser to kind of help address those pore size. Since then, she has had such an improvement. I actually added on microneedling to get a little bit further treatment for that as well. So she had a really great result and was really happy with that laser afterwards. So the Alma Harmony will also do laser hair removal. Most common areas that people are treating is above their lip, their chin, down through their neck, underarms, like bikini area. We can actually even do like full legs, full arms. So that's a treatment where it's anywhere between like 6 and 10 sessions. Each treatment spaced out is a little bit different based on how that hair follicle is growing. But again, that is only based on pigmented hairs. So those darker brown or black hairs, it's not going to address blonde or white hairs, but it is an excellent treatment. It's something I've done on myself where it's really great to not have to shave as constantly as I used to. Sometimes patients do have to come back, just depends on their hair cycle. We like to call it laser hair reduction, not removal. You may still have some growth there, but it's definitely going to be significantly lower than what you had when you first came in. So Fraxel is addressing your browns, so your pigment, those little dark spots that you have, and it's also addressing fine lines, wrinkles, and acne scarring. It does not have any indication like reds like the previous laser that we talked about. This one is a little bit more intense of a treatment, so this one is a little bit higher on the pain scale for patients. So we do numb patients for about a full hour, hour and a half for this session. The thing that sets it apart is that it does go a little bit deeper. It's a non-ablative fractionalized laser that's really addressing those pigments very well. It's doing a great job on those fine lines and wrinkles. It is something that we can combine with the other lasers as well if we want to get a further improvement. But this laser is a little bit more intense, so that's why we kind of hold it off as like kind of our big guns treatment. Most of the time the patients are experiencing those superficial dark spots and then those kind of fine lines, wrinkles. The ideal candidate is any patient that has those goals. Also a really great ideal candidate is acne scarring. This laser is excellent for acne scarring, excellent for post-surgical scars as well. That's another big concern, and that's another big reason why we use the Fraxel, is for those more scarring concerns. Some patients, believe it or not, actually like downtime. They like to see that what the laser is doing is kind of creating that a little bit of trauma to the skin, so they can see that what they're investing in is making a difference. Some patients don't want any downtime at all. So if they don't want any downtime at all, Fraxel is typically not the laser that I'm pulling, just because with Fraxel, you're going to have a little bit of redness. You're going to have some superficial dark little dots on your face. The recovery for Fraxel is anywhere between like 7 to 10, 7 to 14 days. I typically tell patients by day 5 is when their skin's starting to look better. With Fraxel, you're going to be red, you're going to be swollen, and you're going to have little superficial brown spots on your face that look like little tiny dots kind of all over the place if we're addressing the hyperpigmentation. If we're just doing wrinkles, just doing acne scarring, you won't typically see that as much, but you'll have at least like 5 to 10 days of downtime with the Fraxel. That's not to say that you can't go to work, that you can't do your normal activities. It's just what your social downtime is. If you don't want other people to see your face like that, that's when you would kind of take a little holiday at home and just kind of treat yourself to some self-care. But if you don't care, as long as you're wearing your sun protection, you can go out and about and enjoy your normal life. With that one, we ask patients not to exercise for at least like 24 to 48 hours because we don't want any sweat getting into the area that we were treating. So the downtime with the Fraxel is a bit more. That's also what kind of helps to set it apart, as well as the intensity. Sometimes you don't necessarily need 4 sessions with the Fraxel. Sometimes you can get away with 1 or 2. Sometimes you may need 6, but this one is a little bit more intense, so we may not need that full series. It really just depends on the patient's goal. So with Fraxel, I'm mainly pulling it for my acne scarring patients or for my patients that have deeper wrinkles that don't want to do filler. So one of my patients, she had some really deep perioral lines in that area, so we were just focusing the treatment there. She had an excellent result, was very, very happy with it. We've kind of done some maintenance sessions, but she's had a great result. And then I have one of my other patients that actually has acne scarring on his body that we've been treating with the Fraxel. The patient's done extremely well with kind of the pain tolerance with that. They've really tolerated the Fraxel well. They've tolerated the downtime well. They've had excellent results. So I'd say those are my, my best patient stories would be for more deeper wrinkles and for acne scarring. It does do great for the hyperpigmentation as well, but most of my patients that have those dark spots don't like those dark spots and don't want more of them, so they don't like the downtime of the Fraxel. So that's why I normally choose the other lasers for that patient population. It's really what the patient is saying to me during the consultation and kind of the way that the patient's acting. So every single treatment that I decide on for a patient is based on the person that's in that chair right at that moment and what I think is going to be best for them. One of these lasers is not necessarily better than the other one in really any regards. It just kind of depends on what their goals are, what their downtime can be, and what their timeline for treatment is. So if somebody wants a faster treatment, I may choose a different laser. If somebody is willing to kind of trust the process and go through a full full series, that's when I may choose a different laser to give them a little bit better results. So it really just depends on the patient's profile and what they're looking for. So I would recommend starting with a complimentary consultation with any of our Apex aesthetic providers. Always recommend doing a complimentary consultation, just coming in, talking about what your goals are, what your concerns are, and what your timeline for treatment is, and then we can really tailor what that plan looks like to you, getting you on the proper skincare first, getting your skin ready for the laser, making sure that it's going to boost that collagen, it's going to address those dark spots. We need some key ingredients in the skin first to make sure that it's gonna work effectively and have long-term results. So that's where I tell all patients to start, is always do a consultation, see what your options are, and then you and your provider can go ahead and decide on treatment from there.